Hi, this is Eunhye Choi. I'm going to validate for Sterile and also wet to dry dressing for validation. I'm going to start with my 7-step, check the physician's order, wash my hands, gather the equipment, identify the patient, introduce myself, explain the procedure, and provide privacy. So I'm going to adjust the bed to my working level. Then I'm going to inspect the dressing site. Okay, no redness, it's not swollen, no drainage. Looks good to me. Now I'm going to set up the sterile field. You make sure reserve 1 inch for all side for sterile field. I'm going to be using normal saline. In this case, this is new bottle. But if it's not new bottle, you make sure it's not expired. Once it's open, it's good for 24 hours. You check the date and the time. In this case, this is new bottle. Otherwise, if it's not new, you make sure the expiration date and pull a little bit. But in this case, it's new bottle. Open. I'm going to open sterile gauze. And then open sterile ABD pad. Now I'm going to wear the clean gloves and remove the old dressing. Discard. Now I'm going to wear the sterile gloves. I make sure I wash my hands again. Oh, actually, I'm not going to wash my hands again because I cannot leave my sterile field once it's set up. So I just discard my old clean gloves. I'm going to switch to the sterile gloves. I put the sterile gloves on my dominant hand first. And picking up from outside to keep it sterile. Pick it up like this. Okay. I'm gonna use my right hand. I'm gonna keep it sterile. So pick up dry sterile dressing, wet it, transfer to left hand. Going to start from the middle, inside, out, discard, Using my sterile hand, pick up the dry sterile dressing, wet it, transport to left side. I'm going to clean the side, inside, out, discard, sterile hand, wet it, transport, another side, from inside, out, discard. Dry sterile dressing, wet it, transport, then I'm going to pack it. Sterile hand, sterile dressing, wet it, transport, pack it. Then I'm going to use the last sterile dry dressing to cover the wound. Then I'm going to use ABD dressing to cover the wound. Go. Open. Transport. Cover. I'm going to discard the sterile gloves and use the tape to secure the dressing. Okay, this has been secured. And cover the area. Make sure everything looks good. It's fine to me. Put the rail back up. Adjust the bed to the lowest level for safety. Put a cold bed next to the client, and if she is not comfortable, you make sure the bed is at the right comfortable position. Then you clean up. And I would document all my findings. I'm gonna date, time, and I indicate the procedure, put my initial, and indicate all the important findings for the on the chart. And then I make sure I wash my hands, and this completes the validation. Thank you.